In this video, we will try and understand what is protein misfolding and the number of diseases which are caused by protein misfolding, what is their pathological basis. So normally chaperones are synthesized in the endoplasmic reticulum. They are responsible for proper folding of newly synthesized proteins. Now in case there is presence of misfolded proteins. So if some proteins do not happen to get folded properly, so what happens to them in a normal cell is they are ubiquitinated, and in the proteasome they are destructed by the process of proteolysis. But however, in case if this quantity of misfolded proteins it accumulates in the endoplasmic reticulum, this can happen either due to some inherited mutation or as a result of cellular stress, aging, or any unknown environmental factors. Now, this leads to accumulation of misfolded proteins and generates an unfolded protein response. Now, what happens is this unfolded protein response activates pathways that increase the production of chaperones because they want to cause proper folding of proteins. So they increase the production of chaperones. Next, there is also enhanced proteasomal degradation of abnormal proteins, and the protein translation process is slowed down. Now, however, if the above steps also fail, so there is generation of endoplasmic reticulum stress. Now in this condition, the cell finally activates the caspases and which leads to apoptosis or the cell death. So this forms the basis of the diseases which are caused due to misfolded proteins. The examples of which include cystic fibrosis, in which the affected protein is CFTR protein or the cystic fibrosis transmembrane conductance regulator protein. The next disease is familial hypercholesterolemia. In this condition, there is the LDL receptor is affected in this disorder. So the loss of LDL receptor leads to hypercholesterolemia. Then Tay-Sachs disease, in which hexosaminidase beta subunit is affected. So due to lack of this lysosomal enzyme, there is increased storage of GM2 gangliosides in the neuron. Then there is alpha-1 antitrypsin deficiency, in which alpha-1 antitrypsin protein is affected. So this leads to hepatocytic apoptosis, and increased enzyme activity in lungs causes destruction of elastic tissue, giving rise to emphysema in the lungs. Next, Creutzfeldt-Jakob disease, in which the prions are affected, which causes neuronal cell death. Alzheimer's disease, the A beta peptide is affected, and the abnormal folding of A beta peptide causes their aggregation in neurons, ultimately leading to their apoptosis.